Welcome to Gamble with Brandl. Today we have a patient on an anti-seizure medication that leads to significant weight gain. Which other adverse effect would she most likely experience? And we are given here a couple of options. So let's think about that. An anti-seizure medication that leads to weight gain. Does anything come to your mind? I hear somebody saying valproic acid, because that stands for valproic acid for weight gain. So valproic acid in fact leads to weight gain. So that's V. What other adverse effect does valproic acid have? Well, generally it has always the adverse effect of any anti-seizure medication. Any anti-seizure medications decrease electrical activity in the brain, so make you slower, slurred speech, double vision, nystagmus, ataxia, but there's nothing on that what we can identify as a general anti-seizure medication adverse effect. So we need to get more specific for valproic acid. So there's a nice mnemonic, AL, valproic acid. Stands for alopecia. So you lose hair and liver toxicity, which is not very common, but if it happens, it can be very dangerous. So these are important adverse effects for valproic acid: weight gain, alopecia, liver toxicity. And if you look here, okay, we can see the liver toxicity, and that's the correct answer. Let's also look through the others if we can identify a drug that would cause a specific adverse effect. So hirsutism, that's too much hair growth, and that's something that phenytoin causes. Then osteomalacia, that's softening of the bone, decreased bone density. That's actually also an adverse effect of phenytoin if we are thinking about anti-seizure medications. And it turns out that phenytoin is a CYP inducer. And it also induces a CYP that is very important for metabolizing vitamin D. So vitamin D gets more metabolized than it's out of our system. And that's why we cannot absorb as well calcium, and our bone health is decreased. So bone density is decreased. Constipation, well, a lot of drugs can cause constipation. Good examples are, for example, opioids, if you are thinking about some CNS drugs, or maybe an antimuscarinic could cause constipation. Verapamil, many drugs can cause constipation. Respiratory depression, also opioids are famous with doing that. Also benzos, particularly if they're together with alcohol, that would be examples for a drug causing respiratory depression.